So what is the order of complexity, and how did it come about, and how can it help practitioners in their practice? So first of all, the first piece is, how did it come about? And as some of you know, I'm an advanced Rolfer, and I have a Rolfing practice here in San Francisco, and I've been in practice for about 8 years. And before then, I was a massage therapist, body worker, working for about 5 years. So I've got about 13 years of private practice experience. And when I was working with clients, I was seeing certain patterns, certain things that helped them when I was working on them. And I noticed that if I worked tissue in a particular way, their soft tissue in a particular way, I was getting certain results. And I started to notice patterns in the way that I was working, and I started to notice, hey, if I worked in a sagittal plane and I worked to open things up in a sagittal plane, I started to get a lot of results, as opposed to trying to work things in a tissue in a rotational plane right off the bat. And that wasn't an original idea. It really came from a lot of the Rolfing thinking, but they never really called it sagittal, coronal, transverse. It was really talking about front to back balance, side to side balance, and eventually rotation. And these ideas came to me not from Rolfing. They came to me actually originally from Art Riggs through his deep tissue classes, where I got a lot of that sense of front to back, side to side, and then eventually rotation. So with respect to that, it was really told to me to bring, to work front to back in a sense of bringing front to back balance. So it was all about balance, and I really wasn't sure what balance meant in the beginning, but eventually I started to work tissue intending to have front to back balance, but really working tissue in this sagittal plane. And I noticed, again, if I worked in the sagittal plane and worked to resolve issues in the sagittal plane, then I started getting better results than if I dealt with rotation right off the bat. Let me give you an example. Let's say someone comes to you and they have they can twist this way very easily, but when they twist this way, there's a bump, there is a blockage, there's a restriction, right? So normally you would think, well, if they don't have as much mobility twisting this way, then let's twist them this way, or let's bring mobility this way. But what I was doing instead of working in that rotation was actually working in flexion and extension, working along the sagittal plane first, and then eventually working in side-to-side in a side-to-side manner second. And eventually I noticed that the rotation actually resolved itself without me ever having to actually go into rotation. So these are the patterns I started to see, and I started to realize, oh, there's something here, there's something to this, and I wasn't calling it order of complexity just yet, but I was noticing that this front-to-back balance, this side-to-side balance, and this rotation really had to do with planes. So that's how it started to come about way back when I started to work on folks, even before working on people in the Rolfing series. So then eventually I increased and widened my training, and I started to go through other types of training. And I started to meet with other people, especially folks in the Feldenkrais world, folks in the Alexander Technique world, and I started to see that there was a similarity between the way that they were working and my idea of this sagittal plane, coronal plane, transverse plane, and eventually rotation. And then I took a training a few years back with Greg Rose through the Selective Functional Movement Assessment training, the SFMA training, and they talked about doing screenings, what they call screenings or assessments, in this order of sagittal, coronal, transverse, and that really sparked an idea for me, thinking, wow, this is how I was working all along. But their order was a little different from the way that I was thinking. Still a fantastic order and fantastic way of working, but it was a little different from how I was thinking. So I started to then question and ask myself, how come I was working in a particular way? What was it what was it out there that could be matching what I was already thinking and how I was already working? And that's when I started to look into the stages of motor development in babies. And one of the big reasons I started to look at the stages of motor development in babies is because, as I said, SFMA did some motor development exercises, but also Feldenkrais did a lot of movements related to baby motor development. So then I started to study the stages of motor development, and I noticed that their movement, the baby's movement, our movement, really followed certain themes of flexion, extension, themes of side-to-side movement, themes of transverse movement, and eventually there was the theme of rotation. And I noticed, wow, this is very similar to the way I've been working. So that those stages and those themes that were showing up started to create an order in the way that we work in the Morales method. And I called it the order of complexity, because every order is, one order starts simple, flexion, extension, and then it becomes increasingly more complex as we move from being laid prone on the floor to eventually crawling, standing, and then walking, and a very fine-tuned walking. So it became more complex as we went along, which is then why I called it order of complexity. So that's how it came about. And this is how we work in Morales Method structural integration program called core integration. This is exactly what we use. We use it for body reading. We see, is there flexion extension? Is there side-to-side balance? Is there transverse movement? And then eventually, is there rotation? So we see that in our assessment, and then we also see it in our work. We actually employ that in the myofascial work that we do. So we then work within planes and work along planes to bring about movement, to bring about functional movement. So that's how it came about. This is what it is, and how it can help us is it works to actually affect not just muscle tissue or myofascial tissue. And this is one thing that we have to really be clear, that when we're working myofascially, we're not just putting mechanical pressure on myofascial tissue. We're actually also affecting the nervous system. And one thing I like to say is that to my students is that, think of it this way. Think of it as, let's say you've got a computer, and in order to get the hardware to work, we usually do something to the software to affect the functioning of the hardware, right? So that's a normal concept. It's a basic idea. We affect the software to, we affect the software somehow, manipulating the software to affect the hardware, the functioning of the hardware, or our accessibility of the hardware. But with the order of complexity, what we actually intend to do is to affect the software via the hardware first. And in this case, the hardware is the body and the tissue. So as a practitioner, you're actually putting mechanical pressure on the tissue to affect the software, which in this case is the nervous system of the body. And the nervous system of the body is then going to give certain cues, is going to give certain allowances, if you will, to the rest of the body. And then that in turn goes back, loops back, and affects the hardware. So in the case of the body, think of it this way. Think of it as working the hardware to affect the software to eventually affect the hardware. So hardware to software to hardware. If you think of it this way, then you start to understand, oh, what you're actually doing is not just mechanically, physically affecting soft tissue. We already know that it's extremely difficult for us to stretch fascia. We're not actually stretching fascia. and we know that fascia gets fluid when we add mechanical pressure to it, but that's not the whole story. We also have to think about the nervous system. And what we do then is if we work, now think of it this way, if we work the body in a certain way, and if we understand the order of complexity and say, okay, this shoulder or this upper thoracic, I should say, isn't rotating as well in the way that we'd like to see it, then we work this thoracic area first in flexion and extension, again using the order of complexity, and we work the tissue first in order and first in flexion and then in extension, and we feel for directional resistance. Remember that term that has come up in other classes and other lectures. If we work in the direction of resistance, then what we might be doing then is working the hardware, the body, to affect the software, the nervous system, to say, hey, it's okay to move in flexion and in extension. And we know from the way that the spine works that the rotation is actually a product of movement along different planes. So we know that working rotation entails working flexion extension and working side to side. So that's how the order of complexity can help a practitioner help their client. You learn a lot of this in the core integration class, but if you understand this concept, you can start to bring it into your practice and think, oh, okay, this person has issues with rotation. Let's look at how the tissue works along flexion extension. Let's see how the tissue behaves and if it's functioning along a sagittal line. And then eventually, how does it behave along a coronal plane? And then I suggest you try it and then have your client get up, move around, or reassess the situation and see if that works for you. The reason that I believe this works is because this is our nature. This is how we move. This is how our spine behaves. This is how our tissue behaves as a result. And if we go in and we work the tissue in the same order of complexity, we are going to then give and bring about functional ease. So that's really the crux of it, folks. Let's see how much time we have. We have a few more minutes. If anyone has any questions, they can feel free to ask. The really neat thing about this is not the fact that, this is a huge discovery, but the fact that practitioners are learning this and then are bringing it into their practice and then are coming back to me and seeing results. One thing I do want to mention is regarding results is something I'll be posting up at some point, and it's a client that I worked with in a series, and we worked with this same thing in mind, with the order of complexity in mind, and this client had a scoliotic pattern. She came to me, and it was a documented scoliotic pattern. We have the documentation. She had a curve of about 42 degrees before the series, and after the series, actually not even completely after, close to session 7 of the series, she got retested, they reassessed, and she had a 12-degree decrease. So she went from 42 degrees to 30 degrees. And again, it was x-rayed, it was measured, it's documented, and this came about with working, what the majority of the things that we did was working with the order of complexity. I did very little movement in rotation. A lot of it was actually in flexion and extension, and then eventually some more coronal work, and then eventually some rotation. But we got to that point in part because we were working in the order of complexity. And I say in part because a lot also had to do with the client and her desire to change, and the homework that I gave her after the session. So, this is something I'll be publishing. I'll be putting it out there, and hopefully you guys will be able to see it. But this is a testament to being able to work with the way that we naturally move, the way that we naturally develop. And speaking of hardware to software to hardware, this software is actually a innate software in us. It's a way of moving that is innate to us, that this is how we started out. So it's almost as if the practitioner is reinforcing or stimulating that original software, that original way of moving. So that's what I wanted to bring up, folks. If you have any questions, feel free to ask. Otherwise, I will see you. Thank you for mentioning the book. I do have the book, Morales Method Core Integration Therapy, out on Amazon. Thank you for mentioning it. So it's available on Amazon. You can look it up as Morales Method Core Integration Therapy. That's the main book that we use for the Core Integration Therapy program. And we bring up this topic of order of complexity. So feel free to look it up. Feel free to check out this video. We will post it up again on YouTube, and we hope you guys have a great day. Thanks again for watching, and we'll see you soon. Okay.